Okay, so good evening. We're going to go over a subject that actually in the last couple of months or even the last year, I've been dealing a lot with it, especially in the hospital that I work in, the rehabilitation department. And I don't know, Sunny, in the last year, we've had a lot of people with amputees due to could be diabetes or car accidents or you name it, and then they had to have their leg or some limb amputated, and a lot of them suffered from after a couple of months, even when they released from the hospital, would be leaving with some type of phantom pain. Well, what happens in rehabilitation, a lot of times they go have the operation, they have the amputation, and only once actually the area where it's been amputated is scarred up and it's healed, they come back to the rehabilitation to start their rehabilitation and start adjusting the prosthesis so they can start walking or using the hand or etc. And a lot of them, majority of them complain a lot about the phantom pain that they feel. So actually, I don't know why, but in the last year, we've had hundreds maybe of these patients, or I won't say hundreds, but tens of these patients, a lot of these patients. And we were always trying to look of different ways to help them. And a lot of them were complaining of all kinds of symptoms. It could be a pain, a burning sensation, could be an itchy sensation. But the general idea is that they feel some sensation in the limb that doesn't exist. And it could drive them crazy because they don't have any way to deal with it. So even with the drugs they've been given to try and release it, it doesn't do that much well. But if it does help, it helps for about an hour, 2 hours, and then it starts coming back. And even a lot of the treatments, mainly in rehabilitation, a lot of they do the mirror therapy. And even with mirror therapy, they weren't seeing that much results. And then they decided to, actually, we started saying that let's try use acupuncture to reduce the sensitivity or reduce the pain that they feel and all the sensation that they have in the area of the amputation. And it had amazing effects on the patient. A lot of the patients, even on the first session, were speaking about it. They had for 2 days, like the sense that they had, the sensitivity in a certain area, whether it's amputation, was reduced by maybe 50%, 30%, but they had an improvement. One of the amazing stories that I had, that a patient was in the hospital and she was suffering for about 3-4 years of phantom pain. She had both her limbs amputated the height of the knee, and this was driving her crazy for 3 to 4 years. And I don't know, and she was admitted again to the rehabilitation department because she had to go through, they wanted to start doing some type of rehabilitation with her and to also get adjust her prosthesis. And the amazing thing is that she saw the acupuncture and she approached me and said, you think I can also get the acupuncture? I said, yes, why not, if you're here? And this was like an amazing result. About after the first session, even about after the needles were inserted, after about 2 minutes, 5 minutes after the needles were inserted, she felt that she had sudden relief. She didn't feel any sensation. And this went on for about 5 sessions. We've done about 5 sessions. And when she left, she had an amazing improvement by about 70, 80%. So it was still there in the background, but it wasn't that severe. So I decided so that it'll be a very good subject. It's very easy, actually, when using scalp acupuncture to treat. It's very easy points. It's not complicated points or a complicated theory. And what you can do, and I thought it might be a good idea to give a webinar on the subject. It's not such a long webinar, but we'll go through some of the points that are very, very useful in with phantom pain. So the first thing that comes into what happens in the brain during a phantom limb pain. So basically, the popular theory of the cause of phantom limb pain is failure in rewiring the sensory motor cortex, okay? And then the part of the brain that is responsible for processing the sensory input and executing the movement gets mixed up, okay? The input is incorrect, and then the brain, this input in the brain is incorrect, and it's having difficulty rewiring itself or reorganizing itself and saying that the limb does not exist, okay? Now, the idea of phantom limb pain, it's not only that your limbs are amputated, it could be any area that might be amputated throughout the body. Could be gallbladder disectomy or etc. And then you have pain in that area, but it doesn't exist anymore, okay? So it could be even not only in the limb, but also in the trunk or any part of the body that's an organ has been amputated from there, and it had some sensory stimuli which was shooting to the brain, and now the brain recognize that the organ's still there, but even though it's not really there, it's still sending out the signal of pain. And that's also important. The general idea is that some sensory stimuli is sending a signal to the brain, and the brain is misinterpreting this information. Also, the sensory cortex is misinterpreting information, and the brain is still responding to it. And then the general idea of what you want to do is kind of rewire the brain in some manner and get that problem behind the patient that doesn't think about it. So this is the general idea of mirror therapy. Mirror therapy, the idea of mirror therapy is if a patient has his hand being amputated, he's got a strong pain there in the area of the hand. What they do this treatments also in stroke or in other neurological problems. But the general idea is to put in the hand into a mirror, okay? And then have the healthy hand side by side, and you ask the patient to look only at the healthy hand. And then what is happening is acknowledging look at the mirror and move his healthy hand. And then you kind of trick in the brain and saying, look, there's no reason for you to send a signal of pain or some sensory stimuli. You can see that everything's normal. And you that's the way they want to try and rewire the brain and get the sensory input correct. So basically the general idea is to rewire the sensory cortex. So typically, if we go into the phantom limb pain pathology, it's just like I said, that the brain is, even if you for years been suffering from some pain in a certain area, okay? Because what happens, let's say you have a diabetic foot and you have to, and the patient has to be amputated, or not a diabetic, there's a lot of pain, and they decide to amputate a certain limb. The pain is still regenerated or sending a signal to the brain. So when they amputate the area where the pain was, the brain is still receiving that information that the organ is still there, and it's still sending out a signal of pain. Okay, that's the pathology of the phantom pain. Okay, so it's kind of saying that it's like a law of projection, that the brain, the sensory stimuli goes from, let's say, a certain area that on the nerve, let's say in this case, let's say the median nerve, going through the median nerve up to the area of the brachial complex, and then going into the area of the dorsal horn of the spinal cord, and goes up to the sensory cortex. Now, anywhere on that area of the median nerve, when I have pressure, it's going to send out a signal of pain throughout the whole median nerve. So even if I have it in the area of the hand or the area of my my hand here, that's the same signal. That's the projection. So even if I have pressure here on the nerve and I'm feeling pain in my hand, it's going to get the signal from the hand. Okay, and then you can reduce it. Maybe it's still having the area of the pressure, but actually there's always projection throughout the nerve. So when you amputate a certain area, the projection is still there. So you want to clear that idea of the projection. So I like to look at the idea that what you want to do, if you think about what's very important for a motor function to occur correctly is that the sensory input needs to be as clear as possible and in the best manner as possible, okay? So you can look at it, if you have an image, for example, if I would take an image of the hand, okay, and let's say everything is like scribble, okay? And the brain sees the area of the hand very, very blurry, okay? It's not seeing it clearly. So he's also going to respond in a non-clear manner. And in that non-clear manner could be a burning sensation, could be a pressure sensation, could be pins and needles, but it's always, or neuropathy, cold, hot sensation is coming from that area of the hand because he's not seeing the hand clearly in the area of the brain. Because if you think about the brain's like a map. So basically what we try to do with scalp acupuncture or in acupuncture, the idea is to kind of come and say, okay, let's clear off all the dust, okay, just like we have done here on the image, clear off the dust. The brain, the sensory cortex is going to receive the input clearly. And when it's received the input clearly, it's going to respond in the appropriate manner. So that's what we want to do, okay? So the idea is in rewiring, we have to reorganize the brain in some manner that it's getting the information very, very clearly. Okay? And with acupuncture, it's a great way to do it. Okay? So the general idea is to rewire. Now, we already spoke about the endings, okay? Now, also in amputee, I want to also speak about the idea of fascia, okay? Especially if we have a lower limb amputation or upper limb amputation in rehabilitation, they feel in this pain. You have to think of also the idea of the fascia. The fascia tissue is a tissue that is known today that it is 17% of the person's body weight. It has over 250 million nerve endings. Over 250 nerve endings. 1 minute, mute everyone. Okay, so think what a vast, dense sensory organ this is. So you could say it's the largest sensory organ throughout the body. Now, one of the major sensory receptors on the fascia is mechanoreceptors. Mechanoreceptors respond to any mechanical stimulation. Could be movement, pressure, touch, okay? But any mechanical movement or change in pressure throughout the area on the fascia is going to send some signal. So think about it. If you have a lot of pressure, that's going to send out a signal of pain because the mechanoreceptors are going to respond to that and send out a signal. If you have a lot of pressure, in the end pressure, a lot of pressure, the patient start interpreting this pressure to pain, okay? And now, if we go to the area of the amputee, if we have an area, let's say amputee, so you have a scarring, okay? You have a scar in a certain area, let's say all these things are the scars, and then the scars the scarring gets healed, okay? It heals, but it's actually putting pressure or putting a tag in pressure on the fascia, on the tissue. Now, because these mechanoreceptors respond to mechanical input, so they get stretched. And because they get stretched, they're going to straight away directly send out a signal towards the brain that this area, there's pressure or pain in this area, or other types of sensory stimuli in that area. So it's not only enough when you're dealing with a certain limb where it's been amputated, it's also recommended to tell your patient, even for us, to massage very slightly that area and try get that area stretched more and more. If we get it stretched more or get the plasticity, the elasticity back into the tissue of the skin or the tissue of where the scarring is, that's also going to reduce that pain that the patient is feeling. So you can do it with tiger warmer, moxa stick, direct moxa, sometimes even needle in the area. But I also a lot of times just massage it very, very softly. Okay, the scar massage very softly at the same time with the needle in, And also I teach the patient to do it itself, and a lot of them respond that the sensitivity goes down and they less and less feel this pain in that area. So that's another idea what you want to do, and you have to always take into account the idea of the fascia. Okay, and also maybe because it's been amputated a certain area, the scar in that area, you think the fascia covers the whole body. It's not only the musculoskeletal system, but also covers the organs. So think about that idea with when an organ's being amputated, the tissue around where the organ used to be, that fascia is also, let's see, contracted or scarred, and that's causing some kind of stretching, which is causing some stretching on the mechanoreceptors, and that stretching is going to send out some type of signal towards the brain. So when we, that's why I always believe that acupuncture in general, also scalp acupuncture, we are working on the fascia tissue. If we're working on the fascia tissue, we actually can also reorganize the sensory system. So if we go now a bit into Chinese medicine, so that's general Western understanding of what's happening in phantom pain. What you want to do, first of all, we want to reorganize the brain. Okay, so it's very important to work on the kidney, because the kidney is the essence. If we only work on the sea of marrow, which is the brain, the kidney generates marrow. Okay, or is one of the organs that build out the marrow. And from there, it goes through the spinal cord. The marrow goes up to the spinal cords, and then sits in the area of the brain. The brain, the now, is actually a connection between the Jing and the Shen. So that means there is some type of also emotional or spiritual idea in the area of the brain. That might be it's like the fire and water, which is the connection of Shen, the heart, and the kidney, which is also very important for new things to occur. So a lot of times when you do acupuncture, one of the first organs you want to think about, because when you go to the idea, if you think about the nerve system in biology is one of the first systems that are built or developed, and it develops together with the skin. So that's also important in biology. The nerve system and the skin come from the same layer, okay? From the beginning, very first beginning. So the nerve system is so deep and so deep in the human body, so you could also initiate it with the kidney, which is actually from the kidney life expands, the way we see where the Ming Meng, okay, the energy between the kidney is also where the area of the umbilical cord connects in the area of the ubricus, and then from there everything is contracted or built, sorry. So the idea is also when you're dealing with acupuncture, what you want to do is tunify the kidney as well, because that's very important when you want to build the marrow and get a better marrow. And if you get the marrow functioning correctly, then a lot of function throughout the body will function well, because that's kind of the basis of the root of the human structure. So a lot of points that you can think about. It's tunify kidney you want to add in as well when you do body acupuncture. But if we come into scalp acupuncture, because that's so one of the organs that I always start the treatment is when I'm and also the kidney is I feel from my experience that it's the basis of the nerve system. Okay, so if we come to YNSA system, there's an area of diagnosis to know if the kidney needs to be needled. Okay, now a lot of symptoms, once this point, the kidney point, cranial nerve point is being needled, a lot of symptoms start disappearing. You start seeing a vast improvement in many symptoms. Now the kidney point, also according to Dr. Toshikatsu Yamamoto, the inventor of the YNSA, he says this is one of the most important points in his system. And he said the kidney is one of the most important points in the nerve system, which accumulates connection, sorry. So always in his diagnosis, he always starts from the kidney, and he sees what the situation is, then he needles that kidney. Now, all going back to our idea that we want to build marrow or tunify the kidney point. So this is why this is also going to be the first point we're going to palpate. And by palpating it, is going to tell us which area we need to needle. So so we know the area of the kidney neck diagnosis, palpation area. So if I have the clavicle here, okay, this is the clavicle, okay, this is the area of the manubrium, okay. Then let me change my color. Okay, let's draw out quickly the muscles. So we have over here the sternocleidomastoid, okay, and it also goes to here. So the kidney diagnostic point is on the posterior borders of the sternocleidomastoid and the clavicle, okay. That is the kidney diagnostic area. You can palpate them on both sides. So I'm just going to open the image, stop sharing. You can see my image, go out of gallery. Okay, so I don't know if you can see, this is my sternocleidomastoid. It goes down to the clavicle. Here we have my clavicle. Okay, here is my manubrium. So this is in between the muscles. Here is posterior. So this is the area that you want to palpate. Okay, and you palpate backwards. You push backwards, not more than 2 pounds or 1 kilograms pressure. Okay, and you always want to start from a slight pressure and slowly exceed the pressure. And when you feel some type of sensitivity, then the point that will be needled will be the cranial nerve point, which sits around, if we have bladder 2, bladder 3, about from bladder 3, we go 1 centimeter into the hairline, and we look for a little nodule, and that's the area that needs to be needled, okay? And you can do it simultaneously. You can palpate here and even push it in certain directions until you feel the area in the kidney diagnostic in the neck releases. Once the area is less sensitive for the patient releases, you know that you're in the correct point. Now, it's not you're going to needle perpendicular, okay? You can needle in the direction that you push in pressure. So if I'm pushing backwards, let's say I'm in that area of the kidney diagnostic point, which is around about the needling point, which is around about here, and I push back and it improves, then I'll needle backwards. If I push forwards and it improves, I'll needle forwards. If I push to the side and it improves, I'll needle to the side. Okay, so let me go back to PowerPoint. That's a diagnosis. So if we have bladder 2 here, okay, and we're going up to the hairline, around about, if we go from the hairline, okay, around, slide from around urinary bladder 3, we go about 1 centimeter, not more than 1 centimeter into the hairline, which you see here. That's the kidney point. Okay. Now, the kidney point, the kidney cranial nerve point. Okay. And also, according to Dr. Yamamoto, the kidney cranial nerve point is also associated with the olfactory point. Now, this is very interesting because the olfactory connects to the area of the memory in the brain, the hippocampus area, okay? Now, this is one of the olfactory nerves, is one of the nerves that have kind of, even if it's been damaged, it regenerates. Okay, it's got to do with survival mode. Why does it regenerate? Because we used to smell our food. And it's why it's connected to the memory area. So we smell our food. If we smell food's bad, we don't want to eat it, okay? If we feel it's good, we eat it, okay? That's why that area, that's for survival, regenerates. Okay, so you can think of that connection to the kidney. Now also think about this olfactory, through the olfactory nerve, you actually, when you smell something, it throws you back in memory. And this is the reason, because they're both connected. Now here, if I have the drawing. So if we have the hairline here, okay, this is the mid-sagittal line. Okay, this is bladder 2. Okay, this is about bladder 3 area, half a soon into the hairline. So the kidney point is about 1 centimeter above, around about here. Wait, that's bad color. Okay, it's around about here. So what I was saying, that in the needling, when you want to needle the point, okay, so you needle it in the direction that you pull on it, and it improves the area of the diagnosis. So if I'm pushing down, okay, then the needling is going to be downwards. If I'm pushing to the side and it's improving, the needle is going to be to the side, or backwards or upwards. Otherwise, you can do it perpendicular, but you can really play around with it and see what improves this area a lot more. So I know people here have passed my YNSA course. In general, all the points of YNSA I've discovered that are important. The direction will also improve your diagnostic areas. So you can use it in your practice. So that's the first point you want to use when you're dealing with phantom pain. And if you want to know if it's left or right, which do I do? Do I do kidney on the left or kidney on the right? In general, usually you're going to do contralateral, okay? That's one way. You can do it for the amputations on the right side, then I will do the points on the left side. That's one way to think about it. Another way is just palpate both kidney points, and the one that is most sensitive, that's the side which you're going to choose to needle. Okay, so that's the first point. Okay, another point is actually what's important. It's actually more of a region or more of a zone. It's all the area around do 16. Right? That's the second point. If you think about the channels that come up from the kidneys or the bladders that go up, or the do channel that goes up, this is the area where there's a change of an angle, okay? And sometimes when there's insufficient chi flowing through the do, the area what we see here, chi gets stuck in this area. Okay, especially when you have amputation, the chi goes up and gets stuck here. And because it gets stuck, then it might trigger off the idea of pain. So it's not that you're going to needle this point. The idea is that you want to open up this area, and then you're going to basically use the needles as a bridge. What does it mean? That you're going to insert it, and then the chi that goes up through the do channel, because the do is also very strongly connected to the nerve system. The do is going to flow up, and then it gets stuck. Let's say at just below the occipital protuberance. So you insert the needle, and then the needle is like the bridge that allows the chi to continue carrying up and fulfill its movement, go right to do 26, area 27. Okay, so that's what you want to do. That's the general idea of this needling this point. It's also a very strong area that connects, another way to connect with the brain. And through that point is also another connecting to the brain to actually connects to the pain gate area. So you also want to clear up that area. So the needle in this case is what you want to do is, if I'm drawing here the occipital protuberance, okay, this is the occipital protuberance, okay? Right about here is do 17, okay? So you want to go between do 17 and the occipital protuberance, which will put you around about here, okay? And down here is do 16. And you want to insert the needle downwards in this direction, about 3 centimeters in. You thread in, okay? Start from there. You overlap the occipital protuberance, and then you go over to 16. So basically, you're going to finish up around slightly below do 16. So if this is do 16, you're going to finish up around about here of the needle. So it's about 3 to 4 centimeters of threading. Okay, these are master key points of Yamamoto, of tinnitus, but we want to take that away. But the idea is to thread through those points, and it also has an amazing effect. Already by just using the kidney and using that threading technique of around do 16, already then after about 2 minutes, you can ask the patient how they feel, and already then they will say, I feel there's already some change in the area where I'm feeling pain. So these are the 2 points. That's point number 2. Point number 3 actually comes from the Chinese scalp acupuncture method. Okay, and it's actually the area. Okay, now it's actually a combination. I like the combination of using do 20. Okay, and also points from the Jiao style of scalp acupuncture, which actually influences the whole body, the whole qi of the whole body, which is the line, which is about half a tsun lateral to do 21 and 20. Okay, and you insert the needle one from do 20 this direction and from do 21 this direction, and they meet. Okay, that's from the Chinese. These are the black lines you see here. But if we go to do 20 and we speak about the scalp acupuncture in general, no matter if it's Jiao or Zhu style of scalp acupuncture, Zhu also speaks about it, that the area of do 20, it's a holographical understanding of like someone standing up, standing upright, okay, direct up. So you have the cortex, but it's also the area, I mean the vertex, but it's also the vertex, but it's also the area of the grind area, okay? And we know that all the unique channels, the Ren channel, the Ren channel, the Du channel, the Chong channel, they spring out from the area of the grind. Okay, so when you're doing do 20 from Zhu scalp acupuncture, you're also having an influence on the idea of the grind. So you're having a very strong influence on the area of where a life sprouts. Okay, from those areas where those channels sprout out. So you're having a very strong influence on the invigoration and flow of blood, which is through the Chong, and you're having also a flow of Ren or Du, which is the nerve, the fire of the nerve, and also the Yin of the kidney of the Ren channel. So this is also one of the points is going to be do 20. But what I like to do with do 20, I don't just needle do 20, I go to 4 corners, okay, like the C point. So you go one from needle from there, one from there, one from there. But all the point, the idea of these points, they all meet in the center around do 20, okay? So that's point number 2, zone that needs to be needled. So that's also another way you influence in the brain. It's like a connection between yin and yang, because you have the highest point on the scalp, but it also influences the area of the grind. Okay, so it's the connection of yin and yang, and also the holographical, think of someone standing upright, okay, and how it influences the bottom area. And if you see the images here of Zhu, you can see the idea of the connection between the yang somatotope of Zhu and the yin somatotope of Zhu, which connects in the area of do 20. So that's point number 2. And then we have these 2 points, which starts from do 20. Basically, the same idea of Jiao speaks about that same idea that I spoke about Zhu, that it's the connection that connects with the area of the grind area, but it also connects with the lower extremities. And remember that idea when I was speaking about the projection, nerve projection. So because you're having the influence on the lowest part of the body, it's going to influence right up to throughout the whole nerve system, because it goes to the furthest part of the body, which is the most distal from the area of the scalp, from the brain. So actually have an influence on the whole nerve system. Okay, and that's the points of Jiao. And the needle in direction of these points. So if this is do 20, okay, so this is about half a tsun, this is do 20. Okay, so it goes slightly distal, about half a tsun lateral to do 20, and you insert the needle in this one needle in this direction, and the opposite needle in this direction. Okay, now these needles are not needles contralateral, just like in scalp acupuncture, where you do contralateral. If the problem's on the left, you needle the right side. In this case, you want to needle both sides, okay? And the stimulation is once the needles are, it's kind of more superficial. Once the needles have met each other, you stimulate like this every 5 to 10 minutes. You go back and you give about 112, okay, for about a minute, 2 minutes, and you let the patient, you relax the patient and move on, okay? And you come back. what you're going to start seeing after already you've done here, this is about the fourth areas. You'll start after about 10 minutes, the patient's going to get to a situation. They might even say, I don't feel anything. Now, this treatment is repeated in a couple of sessions, okay? But these are the key, one of the key points. These 4 points are the key points. Now, I want to speak to you also lately. I've also started adding another function or another group of points to these scalp acupuncture, and it's what I'm trying to needle here is an area which is called the dorsolateral prefrontal cortex. The dorsolateral prefrontal cortex is an area in the brain that you could say in some manner it's a connection between a lot of emotional pain can be treated through this area, okay? Basically, it's but if we go into the anatomy and the physiology of this area, traditionally the dorsal frontal cortex, the DLPFC, is considered as the brain area associated with domain general exercises control functions such as task switching, okay, from memory, planning, inhibition, okay, all this area there. So if you think about the idea, this area is damaged, also the planning might be missed off. But I want to less, that's the area that the the dorsal prefrontal cortex deals with. But what is more important for me, that it has a very strong connection to behavior and emotional expression, okay? So you could say that this area has some effect also on the emotional state of the patient. So also when they do deep cranial stimulation, this is on depression, okay, in general, this is the area that's been stimulated when they want to deal with depression or emotional problems on the patient that are very rooted in the brain. So like deep depression, that's the area which they stimulate, okay? So the idea is that it has a very strong emotional effect. So that means it has also a very strong effect on the Shen. So we know that if we uprise the Shen, the patient's also going to feel a lot better, and it might be in the background the pain, but you'll have a lot more ability to deal with it, and it won't take him down. So actually, you could say that he's in some way emotionally starting to readapt the brain and then responding differently. Basically, these areas are, you needle 3 points, very superficial, which are gallbladder, because that overlaps that area, which is gallbladder 15, gallbladder 16, and 17, okay? So you go, so if you have 14, 15, 16, and 17, so you can needle these areas too, okay? So I do recommend to add those on into the treatment. Basically, studies have shown that this center, when you on the right side, deals more with pain, and the left side is more to. Even the studies that have been shown, they say it's not like what's the word I'm trying to say? It's not totally proven, but there is some hypothesis that on the right hemisphere of this area, it's got to do more with the pain, and the left hemisphere has got to do more with the emotional state of the pain. So basically, I would recommend you can needle. I mainly needle these states because I want to have the emotional status on the patient, mainly on the left and less on the right. But if you take the idea now into Jiao scalp acupuncture, the vasomotor line sits right when you start. You go to Do22, and actually you thread a needle from Do22 towards Do16, okay? And you're going to start from there, and you thread the whole direction in that manner till you overlap Do16, or even slightly in a direction that is slightly anterior to Do16, and then actually overlapping that area. But also you overlapping and causing a better blood flow in the area of the amputation, or better blood flow throughout the body, and also reducing blood pressure. So this is what I like to do in these points. I go to Do22, and then I thread in a slight direction towards gallbladder 16, or slightly anterior to gallbladder 16. but I want to try and overlap gallbladder 16 in the threading. And I do it bilaterally, okay? And that also has an amazing effect on the blood flow, blood pressure, and it improves blood flow throughout the body. If you improve blood flow throughout the body, you're going to open up stagnations and you're going to open up blockages. You're going to also reduce pain. But I also, so I'm actually having the influence on the blood flow and also having the influence on the area of the, which I spoke about here, the dorsolateral prefrontal cortex. So those are these combinations of these points all together of Jiao scalp acupuncture, Zhu scalp acupuncture, some Chinese acupuncture, and Zhu I found very, very useful for treating phantom pain, and we're getting amazing results in the hospital, and I've been using it also in the clinic with amazing results with the patients. So I do recommend you guys try it at home or on your patients coming off that kind of complaint. Okay, so any questions that came up? Again, I'm gonna, if anyone had any questions, wait, let me open up so you can all unmute yourself, whoever wants to ask a question. Okay, so you can, if you have a question, you can all raise your hand or unmute yourself.
I want to ask a question.
Yeah.
I want to know if you do this, if they just had an operation, should you do it immediately after the operation? Should you do it daily, the treatments, or do you do just many in the beginning and then once a week, or how do you work?
I see them twice a week in the hospital. I see them usually when they come back with the phantom pain. I don't see them that. Basically, all the masters of the scalp acupuncture speak about to do it as soon as possible. Okay, so if you can do it after the operation, then do it after the operation. But if not, I usually see them even 3 months, 4 months after the operation, and we're getting very good results. Just because these are the patients I see in the hospital. I don't really see them directly after the operation.
And you can use the same points every single time when you give the treatment?
Basically, yes, that's what I start with. I do about 10 sessions. I use the same points, and then I start playing around more and more. But already then they have a lot of reducement in the sensitivity and the pain, or the sensation that's coming from the amputation.
So if they had, for instance, broken their shoulder, would you do the same thing? Would you go in and work immediately on
the
that?
shoulder? No.
No, but that's another question. I know.
I haven't tried them on the broken shoulders or anything like that, but I'm basically, if you think about the general idea, then yes, but you might need different zones here to be used. But for because a shoulder pain, if you've broken the shoulder, that's pain that you're going to have there anyway. You've broken some organ. Okay, it's not phantom pain there. Phantom pain is some damage that is there's something that's not, the brain is not rewiring itself and keeps thinking that, receiving that pain. When you have a shoulder pain, maybe you should try to see to avoid a phantom pain later on, or some pain later on, chronic pain. But usually it heals and then it's okay. So it's less with broken. I haven't tried it with fractures.
Okay, you haven't. Okay. Have you ever worked on someone with a fracture who doesn't do the operation, who just lets it heal by itself?
You know, a lot of people that with rib pain, they have a fracture and they can't do anything. They just let them heal themselves. So I use acupuncture in general. Also scalp acupuncture very much helps them. I also teach them certain points in scalp acupuncture, mainly Yamamoto scalp acupuncture, they can massage for themselves to reduce the pain.
Yeah, exactly. Thank you.
But in general, you can, I have a lot of people in the rehabilitation from car accidents that have a lot of fractures, and we use it. And sometimes I just, if I'm there for 6 hours in the session, I could leave the needles in for 6 hours. That also I mentioned, forgot to mention, look, The recommended is to leave the needles in for about an hour. Okay, you can even, if you can leave it for longer, leave it for longer. Okay, but that's what recommended, a minimum hour. After about 10 minutes, the effect already gets starting to be a lot more, the patient will feel a lot more the effect.
Okay, great. Thank you. Fantastic. Thank you, David.
Welcome. Okay, so if there's no more questions, I'll just